Malignant peritoneal mesothelioma is a sort of most cancers that develops within the peritoneum. The peritoneum is a skinny membrane that covers the stomach's hollow space and the organs inner of it, such as the belly, liver, spleen, and intestines. This kind of mesothelioma is rarer than pleural mesothelioma, affecting the lung lining or pleura, and influences around 600 individuals every year. Peritoneal mesothelioma has a more favorable analysis than pleural, testicular, pericardial mesothelioma. Sufferers who go through remedy may additionally stay 5 years or more in maximum instances. Peritoneal mesothelioma forms within the lining of the abdomen, peritoneum, and makes up around 10% of all mesothelioma instances. Signs and symptoms consist of belly pain, bloating, and fluid buildup inside the stomach. Even though mesothelioma regularly has a poor fitness outlook, prognosis, peritoneal mesothelioma patients might also stay 5 years or longer in of cases. Treatment alternatives can help patients stay longer. Who is prone to peritoneal mesothelioma? Asbestos is the only recognized motive of peritoneal mesothelioma. Individuals with an excessive risk of asbestos publicity are much more likely to broaden peritoneal mesothelioma. Excessive danger businesses include blue-collar people, veterans, and people who live close to asbestos mines or herbal deposits. Circle of relatives, individuals, and friends of folks that worked around asbestos may be prone to growing belly mesothelioma via secondhand exposure. Reasons for peritoneal mesothelioma. Peritoneal mesothelioma is resulting from asbestos fibers harming normal, healthy cells inside the abdominal lining. Exposure. Reasons for peritoneal mesothelioma. Peritoneal mesothelioma is resulting from asbestos fibers harming normal, healthy cells inside the circle of relatives, individuals, and friends of folks that worked around asbestos may be prone to growing belly mesothelioma via secondhand exposure. This could arise when individuals build up over the years. The fibers irritate healthy cells and harm cell DNA, inflicting most cancer cells to develop and the peritoneum to thicken. Damage. Mesothelial cells keep growing and unfold, in the end forming tumors. Most cancers, the warmth, lets in the drug to higher permeate the tissue and magnifies the kill. Cisplatin is most often utilized in HITHOC, but additionally doxorubicin and mitomycin C may be used. Cisplatin is most often used in HITHOC, but also doxorubicin and mitomycin C can be used. This occurs due to the fact asbestos fibers can live dormant for years, then provoke cancerous alternae a long time after the preliminary publicity. Abdominal mesothelioma signs and symptoms have a tendency to be indistinct and moderate, so many sufferers aren't diagnosed until after most cancers has extensively spread. Commonplace signs and symptoms of peritoneal mesothelioma encompass belly fluid buildup, abdominal, stomach, ache, bloating, belly distension, blood clots, constipation, immoderate sweating or nighttime, sweats, fatigue, fever, loss of urge for food, nausea and vomiting, swelling or fluid inside the stomach, ascites. If you have been exposed to asbestos and are experiencing any of the signs and symptoms indexed above, touch a physician as soon as viable. The sooner you get a diagnosis, the sooner you may get existence-extending treatment. Use our loose Doctor in Shape tool to discover a mesothelioma professional nowadays. Peritoneal mesothelioma diagnosis. Peritoneal mesothelioma is frequently identified through a chain of exams. Common mesothelioma prognosis strategies encompass imaging assessments, blood tests, and biopsies. Peritoneal mesothelioma does not yet have a formal staging system. A computed tomography (CT) scan is frequently the first test used to diagnose peritoneal mesothelioma. Doctors order CT scans to test for abnormalities when a patient first complains of stomach issues. The best way to affirm a peritoneal mesothelioma prognosis is through a biopsy. Medical doctors will take fluid or tissue samples via a needle from the affected region and use a microscope to search for most cancer cells. Because belly mesothelioma signs can be vague, moderate or go undetected, it's miles regularly misdiagnosed. Medical doctors might also misdiagnose most cancers as irritable bowel syndrome, IBS, Crohn's sickness, gallstones, hernias, or ovarian cancer in women. In case you consider you have got peritoneal mesothelioma and had been misdiagnosed, it's miles critical to get a 2D opinion to get an accurate analysis. Prognosis for peritoneal mesothelioma. Although mesothelioma is understood to have a bad diagnosis, peritoneal mesothelioma, this will vary primarily based on numerous prognostic elements, including an affected person's basic fitness, mobile kind, unfold of cancer, available treatment alternatives, and greater. For example, an affected person in excellent normal health may be able to withstand extra aggressive treatment options to kill peritoneal mesothelioma cancer cells. Mesothelioma has 3 cellular kinds that could significantly affect a man or woman's prognosis. An affected person with epithelial peritoneal mesothelioma will probably have a higher diagnosis and survival time than patients with sarcomatoid or biphasic cells. Peritoneal mesothelioma existence expectancy. There were numerous studies conducted to analyze the life expectancy of peritoneal mesothelioma sufferers.
2009 multi-institutional take a look at observed that 405 peritoneal mesothelioma patients that underwent cytoreduction with HIPAC, the technique that entails surgical operation and heated chemotherapy.
Consistent with a 2020 take a look at from Rutgers Cancer Institute of New Jersey, the median typical survival, OS, of peritoneal mesothelioma without treatment is 6 months to at least 1 year. It's miles essential to remember the fact that lifestyle expectancy isn't always definitive. An excellent manner to improve your prognosis and boom life expectancy is to get hold of a healing mesothelioma remedy. Peritoneal mesothelioma treatment. There are numerous peritoneal mesothelioma treatment alternatives available to kill cancer cells and save you cellular boom, metastasis. Your physician can be capable of determining which sort of remedy will paint first class in your particular case. Cytoreduction with HIPEC. One of the best peritoneal mesothelioma treatment alternatives is cytoreduction with HIPEC, additionally known as the Sugarbaker approach. This surgical treatment turned into invented by using Dr. Paul Sugarbaker to put off most cancer cells and growth the chances of remission in peritoneal mesothelioma patients. Cytoreduction with HIPEC entails 2 steps. Carry out invasive surgery to remove all seen tumors through a system known as debulking. The stomach lining can also be removed. Flush the abdominal cavity with hyperthermic, heated, intraperitoneal chemotherapy, HIPEC, to take away any leftover most cancer cells. Sufferers with early-stage mesothelioma are typically true ordinary health qualify for the cytoreduction with HIPEC manner. Chemotherapy. Chemotherapy pursues to reduce stomach tumors and kill most cancer cells. This treatment technique is regularly used for sufferers that do not qualify to go through cytoreduction with HIPEC. Chemotherapy is best for peritoneal mesothelioma patients whilst the usage of pemetrexed is in combination with either cisplatin or carboplatin. Sufferers with late-degree peritoneal mesothelioma commonly get hold of chemotherapy through an IV drip via the arm. Palliative care. Palliative care targets to hold overdue level peritoneal mesothelioma sufferers comfy towards the quit of their life. This remedy plan is commonly used to alleviate symptoms and pain. Radiation may be used to dull the mesothelioma and simple uncomfortable symptoms. Regrettably, radiation may be a risky alternative for the reason that it can damage the belly organs. Any other palliative care option for overdue level peritoneal mesothelioma is a fluid drain. Uncomfortable abdominal swelling from the buildup of excess fluid may be managed via draining the fluid through paracentesis or an acidic faucet. Even though radiation may be risky for peritoneal mesothelioma as it can harm the belly organs, it may be utilized in past degree peritoneal mesothelioma cases to ease symptoms. Rising peritoneal mesothelioma remedies. Peritoneal mesothelioma has traditionally been dealt with through chemotherapy and surgery. However, researchers retain to examine this cancer to discover new remedy options. And with a bit of luck, a remedy. Medical trials of novel tablets are ongoing in mesothelioma. The most current development in peritoneal mesothelioma treatment is a mixture of immunotherapy drugs. An aggregate of atezolizumab and bevacizumab targets the PD-L1 gene to slow the increase of latest blood vessels and cancerous mesothelioma tumors, The Section 2 scientific trial through the University of Texas MD Anderson Cancer Center determined atezolizumab plus bevacizumab to be nicely tolerated for sufferers with advanced malignant peritoneal mesothelioma. About 61% of patients had been development-free, and 85% had survived for 1 year. New and powerful treatments including atezolizumab plus bevacizumab will become available to most people as researchers hold to refine those emerging techniques. One of the fine methods to improve your prognosis is to be handled by way of a top mesothelioma expert. Those doctors have many years of experience to present the great treatment viable to help peritoneal mesothelioma patients stay long, wholesome lives. One of the world's maximum renowned peritoneal mesothelioma specialists is Dr. Paul Sugarbaker. Dr. Sugarbaker pioneered the cytoreduction with the HIPEC process and dealt with over 1,500 most cancers patients before his retirement in 2021.